Hello, my name is Alyssa Joy, and I'd like to thank you for taking the time to listen as I share the details of my Capstone project aimed at improving mental health care for individuals in the state of Maine. Before I dive in, I want to express my sincere gratitude to all the patients, families, providers, and community partners who made this endeavor possible through their participation and collaboration. A core focus was obtaining feedback directly from those impacted, individuals dealing with mental health challenges. I also spent a considerable amount of time in discussion with and getting insight from medical professionals who spend much of their time working with patients with mental health disorders. These responses were invaluable. Many individuals expressed feeling truly heard, supported, and hopeful. Families shared how grateful they were for the emphasis on education and easy access to available resources. While by no means perfect, the feedback signaled I was on the right path towards a more compassionate, recovery-oriented system of care. The multi-pronged intervention was carefully designed to enhance the mental health care experience for patients and families in several interconnected ways. First, I aim to improve access to quality, evidence-based services by educating on the availability of telemental health options. This allows patients to connect more easily with the right care at the right time in a stigma-free environment. Secondly, I set out to empower patients through comprehensive education on their conditions, treatments, and self-management strategies. I also included information on easily accessed peer support groups facilitated by individuals with lived experience to foster hope and reduce isolation. Prioritizing prevention and early intervention efforts through educating on available warm line and peer support programs was also something I focused on. By addressing needs proactively, I aim to reduce strain on crisis services. In planning and implementing each of these intervention components, I attempted to be meticulous in the application of evidence-based practices derived from peer-reviewed literature and practice guidelines. Extensive research demonstrates the benefits of integrated care models in terms of improved outcomes and cost savings. This according to Seekles et al. Of 2021 and Sanderjay et al. Of 2022. Other studies highlight how peer support services act as a powerful catalyst in the recovery process. This according to Bessette et al. Of 2022 and Lay et al. Of 2020. I carefully reviewed and synthesized this evidence base to ensure the efforts aligned with the highest standards and latest best practices. Technology was a pivotal enabler, helping this intervention overcome access barriers and facilitate coordinated care. Secure, user-friendly telemental health platforms are what allow patients to connect virtually with providers for counseling, medication management, and other services. This flexibility helps to remove transportation hurdles and allows care to be received in the comfort of one's home environment. Technology is also what made the creation of this Capstone intervention project possible, using an online design suite to put all of the information together in a concise, aesthetic educational brochure. On the technology front, I identified opportunities to expand capabilities even further moving forward. Top priorities include automated appointment reminders and secure messaging to boost engagement, symptom tracking apps to monitor patient progress, and virtual options for peer support groups to increase attendance. While a valuable enabler, the human connection remains paramount. Technology should serve to enhance, not replace, that therapeutic bond between provider and patient. My Capstone project could not have been realized without the strong health policy foundation and leadership in Maine prioritizing mental health care reform and efforts. Over the past decade, our state incrementally implemented expanded parity laws to enable better coverage for mental health services and eliminate discriminatory insurance practices. There has also been a concerted push, driven by advocacy groups and professional associations like the American Nurses Association, to invest in community-based mental health resources, crisis services, and preventative programming. As baccalaureate-prepared nurses, we have a pivotal role in not only implementing these policy advancements, but advocating for their creation and refinement in the first place. We can leverage our frontline expertise to illuminate the on-the-ground realities and push for meaningful reforms. Our professional code of ethics compels us to be a voice for society's vulnerable populations, a tenet we strive to uphold through civic engagement. Looking ahead, my capstone intervention lays the foundation for broader mental health care transformation that I hope to see enshrined in future policy. Key areas I will continue advocating for include workforce development solutions to address the crippling mental health staffing shortages, payment reform models incentivizing value over volume of services, and increased investment in supportive housing and employment programs as recognition of their critical role in recovery. There is still much work to be done, but I'm encouraged by the momentum and receptive audience of state policymakers. It's still early in the rollout of my intervention, but the initial response and feedback suggests my intervention is exceeding expectations in several areas. My initial predictions around improving patient satisfaction scores and reducing unnecessary hospitalizations are being realized, and in some cases surpassed. I have seen multiple patients, even within the small emergency department where I work, be able to use these resources to manage their mental health emergency and avoid hospitalization using available support resources. Patient-reported quality of life scores from standardized assessments also demonstrate promising improvements. However, this did fall short of targets in a few areas, like the adoption rates of the peer support services, which have been slower to gain traction than anticipated. That said, the core components of this intervention show strong generalizability and potential to be adopted as a best practice model for transforming mental health systems, both within Maine and beyond. The emphasis on interdisciplinary coordinated care that empowers patients aligns with national quality priorities and innovation trends. The American Psychological Association recently published a report calling for the exact pillars evident in this Maine initiative: integrated behavioral health in primary care, greater utilization of technology and virtual care, and expansion of peer support workforces. This according to the APA in 2023. Other leading organizations like the National Council for Mental Well-Being are disseminating resources and providing technical assistance to aid communities in replicating similar care models. Of course, thoughtful tailoring for local context and continuous quality improvement will remain paramount as I look to implement components of this intervention in new care settings. But there is tremendous opportunity and value in scaling key elements of this initiative to equitably enhance mental health care access and experiences across the state and nation. On a personal level, this capstone project was the most rewarding and transformative experience of my RN to BSN journey. Facilitating the distribution of education on available mental health resources and peer support groups unveiled powerful stories of resilience in the face of profound adversity. It reinvigorated my unwavering belief in human potential and the privileged role nurses play as beacons of hope. Throughout this process, I was reminded of the tremendous ethical and professional obligation we bear as care providers. The ANA Code of Ethics calls us to practice with compassion, respect human dignity, and advocate for the vulnerable, tenets this intervention embodied. My experiences reaffirm the critical importance of cultural humility, trauma-informed care principles, and authentic therapeutic partnerships in providing ethical, holistic mental health treatment. This project also allowed me to cultivate new competencies that will profoundly impact my future practice and leadership capabilities. Developing educational materials and curricula stretched my creativity and reinforced the importance of health literacy. Conducting community needs assessments underscored how social determinants like housing, employment, and stigma erect complex barriers to well-being. I honed skills in interdisciplinary collaboration, conflict negotiation, and change management, deftly navigating the inherent challenges of instituting new care delivery models. Research from reviewing evidence to program evaluation will undoubtedly elevate my contributions. As I reflect on this robust experience in tandem with the invaluable RN to BSN program, I'm reminded of why I went into nursing: to cultivate compassionate human connections and make a lasting, positive impact in people's lives. This journey reaffirmed that calling, while expanding my perspectives on the powerful influence public health policies, community engagement, and systems-level thinking can have on individual and population outcomes. I'm leaving this process inspired and emboldened to be an even stronger advocate and change agent moving forward. The competencies gained will allow me to have a ripple effect, creating a legacy of empowering patient experiences, combating mental health stigma, influencing policymaking, developing highly effective care teams, and driving continuous process improvements with courage and wisdom.